Welcome to week 36. 36 weeks. That means we have 4 weeks left, God willing.
Oh, yeah, I need those 4
You
weeks.
need those 4 weeks.
At least 3
But we're
weeks.
doing pretty well, I feel like.
Yeah,
The last couple weekends, we've
accomplish a
really
lot.
accomplished a lot, and I feel like I'm ready for them.
I feel like we're ready for him. There's some stuff I like to still do, like hang a few things, put the baby monitor up.
Yeah,
But other than that, we're kind of ready, I think.
kind of ready.
I don't know. I said that to someone today. I said, mentally, I'm ready, but work-wise, I'm not ready. Does that make sense?
I don't think you're ever going to be ready work-wise.
No, I'm just
Because
I'm a
you
control
have that,
freak.
right. You're always want to keep working and helping your clients out.
Yeah,
And there's always, with the majority of work, there's always something to do,
I
right?
know. Even when we went on our honeymoon for 3 weeks, I was like panicking.
Right. Anyways, what are your latest symptoms?
Well, besides all the other stuff I have, we are now experiencing, and pardon, my French or whatever, we are experiencing what is commonly known as lightning crotch.
Lightning crotch.
Mm-hmm. So it's these
That's the first one.
sudden like jolts of like pain, I guess, in your crotch, which is basically him dropping, the baby's dropping. So it's
Right.
pressure on your,
How long has this been going on for?
I would say a few days. I've
Okay.
been feeling it. I had it throughout the pregnancy, but it wasn't like
And did you know the
as
term lightning
no,
crotch? And is
no.
that the proper term
When
or is
you
that
when
the
you
slang term?
when you Google it and you learn about third trimester
Yeah.
symptoms, it is what is written, lightning
I'm sure
crotch.
there's some medical
I think
term,
I'm sure
but
there
we'll
is,
go with
but
lightning. If we find it, we'll throw it up on the screen.
I mean, even like these WebMD articles that I read and stuff like that, they do put it lightning crotch.
All right. And
That's
it's the feeling you get when the baby's dropping, and it's the sensation of the pain is lightning in your crotch.
yeah.
No other way to explain
So
it.
like the nerve pain I have up top is from the stretching of, everything and the pressing of all my organs. And now with him dropping, it's lightning crotch.
Okay.
But it's more common. It's like, oh my gosh, I stand up, it's like, oh, I walk, I'm like,
And speaking of walking, you get swollen feet now too.
swollen feet for sure. I've been very fortunate throughout this entire pregnancy up until my third trimester. So like swollen hands, like my ring will definitely get stuck. But my feet get swollen, so I'm always putting my feet up.
And something else we haven't talked about, but you have big horse teeth that are
Well, that
beautiful.
that we know.
And but I did buy you some gingivitis like toothpaste for your sensitive gums.
Gums. Yes, I started getting pregnancy gingivitis probably in the beginning of my third trimester or a little bit before. I didn't really notice it, but during my second trimester, whenever I flossed, I noticed that I was bleeding, and I already have sensitive gums for because of other stuff. But I went to the dentist to get a cleaning, and I asked, and she's like, "Oh, totally normal, like totally." She goes, "Yours is not even as bad." She's like, "I've seen pregnant ladies that are just like gushing blood anytime they brush, anytime they floss." And then on top of everything else, I had to actually get a cavity filled without any medication, anything. He just drilled in there to get a cavity because they were nervous.
All right. So now that we've talked about all the things that everybody gets to look forward to
So
scare
much
them,
fun.
tell us some good things. What is good? What's been going on? What have you loved about being pregnant?
What have I loved about being pregnant? It's not having to suck in when I walk.
Not having to suck in your stomach.
Not having to like it's being able to just
Being
wear,
able to eat an extra 300 calories
being able
and
to
not get
eat
judged.
extra. Yeah, yeah. It's kind of nice. I get to eat my calories. I don't drink, obviously, so it's kind of nice. Like you get to have that second glass of wine and I get to have dessert. Or I get to have, like um but I think also something fun is whenever I get to meet someone else that's pregnant or just had a newborn, it's like you have this instant bond with this person. And we saw that over the weekend. I met how many pregnant ladies or and or newborn mothers do we meet?
I think every person we ran into this weekend was pregnant or
I
had
know.
a newborn. It was crazy.
And it's just exciting because you get to talk to them and learn stuff and this and that. And I don't know, I think feeling him kick and just knowing that in a couple weeks or a little more than a couple weeks, we're going to have
4 weeks.
4 weeks. We're going to have a little
Hang in there, buddy. Keep
bundle.
growing.
Yeah,
He's
he's growing.
he's a little bit over 18 and a half inches and 6 pounds and a few ounces,
Yeah.
and growing. So keep going. And there's one other thing. He at his last doctor's appointment, he we've identified that he's sideways. Transverse, I think, is the correct
Yes.
term.
So when we went to the specialist a few weeks
Yeah,
ago, he was head down. So he was ready for
yeah,
birth. But then when I went to the doctor last week, which was a 36-week checkup, which honestly, it's not the most comfortable checkup, I'll be honest. They're going to be swabbing you for stuff. Um, but, anyways, you weren't there. And she was
the
feeling it.
first doctor's appointment I missed, by the way.
It's okay. And she was feeling him, and she's like, huh, he is transverse, which means sideways. So he's not head down right now. So we have to wait 2 weeks. They'll probably do a scan to see where he's at. If not, maybe some exercises to help move him or shift him so he's back head down. Because if he's not, and I go into labor, you have to do a C-section. And I'd rather not do a C-section. I want to do natural birth.
Right.
So that's something else that's come up
All right.
this week. But we're hoping,
But he's gonna move for us, and
yeah.
we'll be fine.
I think your sister gave us the best advice. And I love what she said because we called his sister.
Who's a labor and delivery nurse as
Yes.
well.
And she said, when babies are ready, they will naturally flip on their own and go back to position. It's like nature.
Right. And you think even today maybe he's already started to move?
I did feel a little bit of kicking or some sort of movement more towards the lower center of my um, torso, I guess, or not torso, abdomen, whatever. So I'm hoping he started shifting a little bit, but
If
yeah,
not, get those exercises going, and just don't try to move him.
I'm not.
Let him move
Yeah,
himself. That's one thing. One piece of advice we did get.
from your sister. And other than that, how are you feeling?
Me?
Yeah, how are you feeling, Dad?
Feeling great. My skin has grown thicker,
Oh,
become even more patient than I realized I needed to be, and I'm just excited for Bryson's arrival. We're counting on 4 weeks, so
we're just hoping not on Super Bowl Sunday.
yeah, that'd be tough. Because you don't know, yeah, when you deliver on that date.
It's like delivering on any holiday.
Yeah, who are you getting at the hospital at that time? Or are they completely sober? If the doctor has to be called in.
Well, I didn't think about that. Now you put that thought in my head. Oh,
Not to scare
jeez.
anybody.
Not to scare anybody, but we'll see. His due date is kind of roughly near the Super Bowl this year, so we'll see. Whenever he decides, but the next 4 weeks are going to be very up in the air.
Right.
So, and I started having a lot of Braxton Hicks.
Oh yeah, what's Braxton Hicks?
So basically, it's like false labor. So my whole stomach will just contract and get super tight, and then it like.
But how often does that happen?
What do you mean? Like throughout the day?
Yeah.
A few times throughout the day, but very sporadically.
So it
You'll
gets tight, and
know,
how long does it stay tight for?
like 30 seconds or a little bit longer, but not like prolonged. So once, if I start feeling that a lot closer in time, I guess that's when I know
That's real labor.
that might be real labor.
So Braxton Hicks is
False.
fake.
It's
false labor.
Yep.
All right. So our next episode will have being week 37 and less than 3 weeks away from his arrival, or less. We don't know. Could come any day now. Anyway, until next time,
Hopefully, we'll see you still pregnant.
hopefully we'll see you still pregnant in week 37.
Adios.